Today is a day where we really have to pay attention to an international and national challenge that we're examining. The look at a horrific infectious disease that is wasting a key continent in West Africa and also threatening the United States of America. But for me, this will be the last full committee hearing that I will chair. Before we go into the substance and I make my statement, I want to thank Senator Shelby and his staff for the wonderful way that we've been able to work together. And though we will exchange gavels, we will also continue to exchange the views in the way we have. I have found in Senator Shelby and on the other side of the aisle always a tone of civility and candor and an ability to, in this committee, to try to work together and find common ground, to deal with America's problems in a way that achieves sound results and to do it in a way that's affordable. I think that's characteristic of our committee, and I hope that as we move ahead that we will continue to do so. I want to also particularly note Senator Cochran, who chaired this committee before, and who also, during the time of Senator Inouye's passing, was a very important bridge to help me as Senator Shelby and I both moved into new roles. And Senator, I want to acknowledge your graciousness and wisdom. So we're about to, on January 3rd, change who controls the United States Senate. But until now, this committee is chaired by me, and I look forward to working with my colleagues to deal with really moving what I hope will be an omnibus, and that we, on December 11th, will not be voting on a CR, but be voting on an omnibus that meets our fiscal 2015 responsibilities and also deals with the urgent need that we're going to hear today. I'm deeply concerned about Ebola, and of course so is all of America, both at home and abroad. I think there is a national consensus that agrees that we need to contain the disease and we need to eradicate it, and also face very clearly the fear that it generates. Now, the epidemiology tells us that there have been 13,500 cases of Ebola in West Africa. Here in the United States of America, there are currently no cases of Ebola, and we look forward for that to be ratified or corrected by our esteemed panelists. However, the United States of America has treated 9, N-I-N-E, 9 patients with Ebola. 2 have contracted it in Texas, the rest in West Africa. 8 have recovered, 1 regrettably has passed away. So there have been 9 in America, 13,500 in West Africa. The situation is serious, and it means that all of government has to respond in a way to do so. My strong suggested principles are this. First, we must fight the disease at its epicenter in West Africa, in Liberia, Guinea, and Sierra Leone. We also want to look at the countries contiguous to these 3 areas that is not spread beyond these 3 countries. We want to use the expertise of the Department of State, USAID, CDC, DOD, NIH, FDA, any government agency that can play a role in making the world, West Africa safe, and us safe is what we want to do. The second principle is we must protect America, and we must do it at our points of entry. And finally, in looking at our country, we need to utilize the best science and deploy our public health and our public health safety agencies in a way that's effective. That's the Center for Disease Control, our state and local health departments, and scientists developing vaccines and treatments at NIH and improving their safety and efficacy at FDA. As we look at what government's going to do, I'm going to thank the people both in our own country and all over the world that have really been working on this. Doctors and nurses, lab technicians, disease detectives, aid workers, soldiers from our own Defense Department, working shoulder to shoulder in Africa and also working at our border, at our ports of entry here and in our own country. And these important agencies, USAID, state, CDC, NIH, FDA, and of course our ever-ready military. There have also been very very wonderful volunteers that were willing to go to the danger zone. And we want to thank them for their role that they've played in West Africa. We also want to thank those in our own country who, though not called upon, places like University of Maryland and Johns Hopkins and my own community were ready to be able to deal with this. I'm glad today to have witnesses from our major government agencies to present testimony. Ordinarily, protocol calls for the most senior cabinet member to testify first. In my usual kind of out-of-the-box way of thinking, I want to deal with the problem rather than focus on protocol. You know, sometimes in the Senate, there's a lot of pomp and circumstance. I'm going to dispel with the pomp and get to the right circumstances. So the way we've organized the testimony is to really start internationally, to hear from the Department of State, and then Mr. Lumpkin from the Department of Defense, then going to our ports of entry, then with Sylvia Burrell, who will be here to talk about HHS. We will hear from Deputy Secretary of State Heather Higginbottom, accompanied by Nancy Lindberg of USAID, who will tell us how are we going to do this in West Africa, and how are we going to do it not only in those 3 countries, but in the contiguous countries. We're going to then turn to Assistant Secretary of Defense, Mr. Michael Lumpkin. We know that he is the official Ebola coordinator designated by Secretary Hagel, and he's accompanied by Major James Lariviere. Then we will hear from Secretary Jay Johnson to discuss America's ports of entry. Then from Secretary of Health and Human Services, Sylvia Burrell, accompanied by Dr. Frieden of CDC and Dr. Anthony Fauci of NIH. And then we say to Drs. Fauci and Frieden, to Ms. Lindenberg, to the very good general who's here, we'll ask you to join us after they testify to be able to answer questions from really this robust participation that we have. Opening statements will be from the 4 witnesses. Now, we have before us an administration request to contain and fight Ebola, an emergency spending request of $6.2 billion, because the Ebola, in my mind, meets the criteria for emergency spending. It's sudden, unanticipated, unforeseen, urgent, and temporary. The request includes funds from the State Department and USAID for $2.9 billion. The Department of Defense to develop technologies to fight Ebola and shorten vaccine development, $112 million. The Department of Health and Human Services to contain Ebola, both with CDC in West Africa. And remember, CDC is both here in our country and also in West Africa. To also fortify, strengthen domestic capacity to treat Ebola with treatment centers available in every state and the appropriate personal protective equipment for caregivers, like our very valued and treasured nurses. We also have money in here to develop new tests for treatment and vaccines, which would be a total of $3.12 billion for HHS. So state is talking about $2.9 billion, HHS $3.12 billion, 112 for Department of Defense, and right now, Homeland Security says it's okay, but it needs a lot of flexibility. Now, the reason I talk about my colleagues to focus on not only the money, but on funding it in an emergency, I say to my colleagues, we faced infectious disease emergencies before. One under President Bush in 2006, and the other in 2009 under President Obama. We worked on a bipartisan basis to do this. In 2009, we were faced with the H1N1 flu epidemic, in which 30 million Americans caught the virus and nearly 3,000 died. We provided funding of $6.4 billion, and we designated that as emergency spending. The bipartisan emergency response in 2009 mirrored what we did to help President Bush, again, bipartisan basis, when we faced avian flu, when at that time Congress responded with $6.1 billion in emergency funding. So we have done this before when we have been faced with an emergency related to infectious disease. I would hope that we would follow the models that we have used in the past. Today, we live in a world that's free from smallpox, that cut polio cases by 99%. Now we have to tackle the new diseases, and we have to have a strong worldwide public health effort, vaccines to prevent diseases, therapeutics to treat diseases, the people and the infrastructure to do that. We've also invited, in addition to government, we've asked for the American Hospital Association, crucial NGOs, and also schools of public health, like the Bloomberg School in my own state at Johns Hopkins, to submit testimony. I want to acknowledge that we've got 56 submissions already, and we will definitely pay attention to them. The common themes are sustained investment is needed in public health, both at home and abroad, and emergency money is needed in the short term.